We're still waiting for Tony Travers to come, but I think there's no reason why we can't get going on our own. As I just said to one of my colleagues on the panel, the only people who've got to please here this afternoon are ourselves. So I think we'll make a start now. Now, my name is Warwick Lightfoot. I'm the head of Economics and Social Policy at Policy Exchange. I'm not going to be hold back at all, but as far as I'm concerned, both here at the Labour Conference and what we will be doing at the Conservative Party Conference, the issue of social care, in my view, is the most important thing that we will be talking about. And I come at this in quite a heavy way, because a large part of my adult life has been spent in one way or another taking an interest in this issue. For many years, I was a local authority councillor, a Conservative councillor, and the first paper I ever had to get to grips with on a social services committee was the Wagner report on standards of care in residential settings. And if you think back 30 years ago, the issues there were, did you actually have your own clothes, or did all the skirts and the pullovers and the pyjamas get put into a jumble, and then, does that one fit you, does that one fit you? We've come a very long way. We've done well in improving standards, but put bluntly, from the 1940s, the gap in our welfare state, the unfinished bit of business, is properly funded long-term social care, whether it's in your own home or in a residential care setting. And certainly at Policy Exchange, where we've done a lot of work on this, we believe that more resources have to go into it, and that in the long term, it will have to be funded free at the point of use, with potentially some question about hotel bills or whatever, but a complete change in the way it's been approached since the 1940s, and that it should actually be paid for through straightforward taxation out of general expenditure. Lovely, welcome. And that we should actually recognise that this is something affordable within public spending if you get your priorities right. So I hope this is something where the centre-right, the centre-left and beyond can come together for a purpose. And I think that as a former Treasury official, I know a spending agenda that you're going to lose. And this is going to be it. So I'm delighted to introduce our panel. I'll start with Tony Travers from the LSC, who runs the local government London unit there, and will be able to frame much better than I've just done the whole challenge of public policy in relation to social care, and the pig's ear and dog's breakfast, to mix up all the metaphors, that both Conservative, Labour, Conservative coalition governments and our Conservative governments have managed to make over so many years. I'm absolutely delighted to actually have Councillor Barry Kushner from Liverpool City Council. He's the Cabinet Member for Children's Services, and I feel very strongly that on occasions like this, it's important to have a voice from an elected member of a local authority who deals with this all the time. Doesn't matter which party they come from, we often do not have sufficient intervention from elected members on these sorts of platforms, so I'm absolutely delighted you can join us. And Dominic from the Alzheimer's Society, who manages social care and that part of their policy agenda, I'm delighted is joining us as well. So I'm going to ask Tony to actually take us off outlining the broad picture, and then we'll work our way through. Tony.
Okay, thank you very much, and good afternoon. Sorry to cut it so fine. Adult social care more generally, has become a significantly more important public policy issue in the last 2 or 3, 4 years. And the reason for that is a short-term reason. The short-term reason is that as the government has sought to reduce the... I don't want to go through all of this, just making the point, saying it as a fact. Reduce the deficit, and in doing that, simultaneously not push taxes up very much, and then prioritise some elements of public spending. What we've ended up with is the unprotected parts of public expenditure, most obviously social care, but not only that, most of local government services being put under very great pressure. And of course, as spending has been held flat in cash across England, that's what happened after 2010, then the number of older people in need of care has increased. The population, that particular segment of the population, is growing substantially over time. So add these two things together, it created a squeeze on adult social care spending, which eventually led the government to decide something needed to be done. And the something that needed to be done was first allowing councils to put up council tax above the previously capped levels, and second, of course, to come along with additional Better Care Fund money, which of course is sort of nuanced because the NHS spends some of it, but in part that was recognising the fact that there is, and everybody in the room knows this, significant overlap between what the NHS spends on older people, adults more generally in social care, so not only older people, adults in social care, and what local government has to do. But of course, underlying all of this... Sorry, I normally can shout, forgive me, can you hear me now? Better, right. In addition to this sort of short-term public spending challenge, there is the longer-term issue that the way in which care, particularly for older people, but not only that, is funded is very different to the NHS. The NHS free at the point of use, whereas parts of adult social care have charges attached to them, and local authorities are required not only to charge for some services but to determine entitlements. So this is a very different funding mechanism to the way the NHS works, and that, of course, given the overall squeeze on public spending, has led to some individuals being shunted from one sector to the other. It's an inevitable consequence of the different funding mechanisms and, frankly, the different amount of money available to the NHS as compared with local government. So that's what's happened in what I would call the short term. But there's a longer term issue which the title of this afternoon's event begs, which is, should social care be funded by the state or the individual? And that raises the question of, if it's not going to be completely underpinned by the state by taxation, and in the past it hasn't been, and other parts even of healthcare are not completely funded by the state, then how should it be done? And that, of course, is in attempting to tackle this issue, gave Mrs May such a difficulty in the 2017 general election by attempting to tap some of the resources that some individuals will build up in their property to pay for older people's social care. It led to a backlash, and that, of course, underlines the long-term challenge that governments of all parties have had in trying to find a way of reasonably accessing private resources to help pay for some elements of social care. So, is it state or the individual? It's a choice. We could put taxes up and pay for it through the state, like the NHS. That would be possible. Fund local government more, allow local government greater freedom to put up its taxes. That would be one way. But the alternative, that is if individuals pay, then we'll either have to come up with mechanisms to make people contribute, like an insurance scheme in effect. An insurance scheme bears with it. We all get, well, then we all, there are insurance mechanisms that pay for lots of things we are not certain we're going to need, but it is one way of, but it requires the state to require people to contribute. So one way or another, either through taxes or some form of compulsory levy or insurance, the state will have to act, because otherwise, in the end, everything will fall back on the state in a different way, and it's unlikely to be particularly easy either for the individuals concerned or for government at the time. Thank you.
There's a very neat summary of how you get into a mess in the 3 easy lessons. So thank you very much.
Okay, well, I've done no more than that. My work is done.
No, absolutely. Back.
Okay, so my view is that the decisions that the government made to reduce public spending had absolutely nothing to do with our level of debt, because, of course, our debt was lower than it was in the rest of Europe in 2010, and it was only been lower, sorry, in 50 out of the previous 250 years. So, for me, the reduction in public public services and public funding had absolutely nothing to do with economics. It was all around politics. These were political decisions, and this was the end of the post-war settlement, where people who had more money and could afford to pay more taxes were the ones basically that were funding all the public services and our welfare state, and now reached a point where they didn't really feel like doing that anymore, and that was articulated through Conservative government, with coalition with the Lib Dems, that I think probably accurately reflected those wishes and represented those people. In fact, they looked like them. In fact, they were them. So I think, I think that's the first point. And I think the other element of it is, I think this government has absolutely no understanding of the interdependence of services. So when they started cutting services, all of a sudden, pressures started to appear in all sorts of different parts of our public services that the government really weren't prepared for. So that has led us into a system at the moment that's being funded and driven by funding crisis. So all the talk about adult social care at the moment currently has got some momentum behind it because of the increasing use of hospitals and the bed blocking, not because it hasn't become a debate necessarily because we feel that older people or people who are infirm or in poor health and can't live on their own and independently, is because there's a problem with hospitals. So personally speaking. So I think that's an issue. And then we get into a situation which is not new, it's one that's been before. So we have a Minister for Health and Social Care that's got no responsibility for funding social care. So that, because of course that's funded through local government and the local government minister. So that also means then that there's actually no funding. There's no funding allocated for adult social care. It's just the decisions that local authorities like us have to make to meet the needs of our people, some of which is statutory responsibility, a lot of it is not, in terms of how we best reflect the need and support and meet the needs of our people in our city in meeting their needs with the services that we can provide. So as a city, we're having to deal with this, having been cut by 62% since 2010. And it's forcing us into relationships with, I don't want to go on too long, so you tell me when I've gone on too long. So to relationships, which is probably a good thing, with health, and the Better Care Fund is helping us at the moment, although that's not a long-term solution in terms of trying to put money into to our adult social care. But we probably pay one of the lower rates for adult social care, for example, than most other cities in the country. But we're having to try and think and make quite creative solutions to very difficult problems. We've actually built, I think we're building 6 reablement centres, including 3 dementia centres, which are community-based, that would try and release that pressure, for example, from people who, I'll talk about them a little bit more if you like, who are in hospital, because we used to have convalescence, didn't we? But we haven't got so much of that these days, that we have to kind of try and build up again so that we can try and support that transition from people moving from hospital back into their own home and then supporting them in their own home through our social care. So I think it's a difficult issue. I think it is part of the welfare state. I don't agree that it should be funded through private insurance. I think that's wrong. We do have a national means of collecting money from individuals to cover these things. It's called tax and national insurance, and I think that's really where this should be funded.
Thank you very much. Dominic, I'm very pleased you're here because a very important part of the work that's done is actually done by the voluntary sector. So having the voice and the perspective from the Alzheimer's Society is very welcome.
I will do what I can. Can I just double check that people at the back can hear me if I'm nice and loud and clear? And I have to say that the policy wonk within me is very excited by the fact there's both standing and sitting going on at an event about social care, and I think that reflects comments in the panel that does highlight just how big an issue this is becoming for so many different people. I am the policy manager at Alzheimer's Society. We are quite a unique charity, I think, in that we actually provide services ourselves. We do research into cure and care of dementia. We have a policy and campaigning function as well as our kind of fundraising and public awareness side of things. And social care is something that comes up time and time again. It really is kind of the biggest issue for the people that we talk to. There are 850,000 people living with the condition in the UK at the moment, and we're expecting that to rise to 1 million by 2021. The speed of growth of this issue and the number of people that are affected by the condition that will need help at some point during their journey, partly due to a lack of a known cure at the moment, but also because of the impact of symptoms, which many people kind of associate with memory loss, but actually can affect every walk of life, can make even the most simple things incredibly difficult to do on a daily basis. And here we are talking about social care. We think of it as something, I think when I first joined the sector, I thought, well, that's a really nice thing that kind of enables people to do absolutely everything they want. No, what we're mostly talking about today is very, very basic support. Actually, what we've seen being lost for people is just that very basic assistance to maintain their dignity, to be able to even just get washed, to get dressed, to get up, to actually maintain even the most simple form of life. We're seeing that being cut to the bones. And it was kind of pointed out by Barry that generally we're saying about 40% of council budgets have been taken away since 2010, specifically around social care. At the same time, as the population is ageing, we're seeing much greater demand. And as a result, actually, in terms of the argument of, well, should the state be paying or should the individual be paying, we've already got the answer to that. Mostly individuals are paying. We're seeing a point whereby more and more people are being taken out of the state-funded system. More and more people are being expected to pay up for their own care and support. Many people that believe that, well, I have paid him for my entire life. They're not seeing much back from the state. They are not being helped to continue being part of their community, where actually they are an economic benefit anyway, to go out there and to spend their money, to be supporting in various different roles, to make sure that actually they are able to be present, visible, to see family members, to do everything that I think that anybody in this room would wish to do. And I'm sure that actually quite a few sitting here and standing here today will have witnessed and seen something from their own family situation. And with dementia, we have a particular problem because it sits within the divide of the NHS and the social care sectors. And this is the same for quite a few different long-term conditions. So if you are diagnosed, perhaps, or unfortunate enough to be diagnosed with cancer or diabetes or heart disease, rightly you will expect most of your support to be provided by the NHS. You will have a clear pathway as soon as you have a diagnosis that will say to you, you can expect A, B and C, and you will get that. And if you don't, there are likely to be repercussions for the system, and there's likely to be an inquiry. That is not the case if you are diagnosed with dementia. If you are diagnosed with dementia, you are largely left to your own devices until you hit crisis point. If you want to purchase your own care, you are liable to be paying 40% more than somebody without the condition due to the complexity of the condition. We did some modelling last year, and generally speaking, the typical cost for dementia care over the course of somebody's journey is about £100,000. Now, the impact of this, A, is to completely eradicate most people's assets. Secondly, is to put people off accessing care when perhaps they could and should, meaning that actually, as was mentioned by the panel, you get to a point where people who could have been helped at an earlier stage to enjoy a good quality of life actually reach the point where they need a red light into hospital. For people with dementia, we know that they're more likely to experience falls there. They're much more likely to be discharged into a care home or to die there. They will spend twice as long in that hospital than somebody without the condition. And if they get stuck there, and we've heard so much political wrangling around delayed transfers of care, that if you do have a DTOC and you have dementia, you'll be there twice as long as well. So actually we see an incredibly unfair and unjust system that highlights just what people are facing on a daily basis across the country. It's great to have somebody local and somebody from a council from Liverpool here, and I expect if we had councillors from all the different areas, each would speak to having a different kind of situation, a different rate of pay for providers, a different number of people they have to support and are expected to support in the future. We know that they're changing and fiddling around with how councils receive some of their money, and that actually that isn't likely to help the situation either. And so moving forwards, I think we really need to be thinking, well, as a society, what do we want to do? What do we want to achieve? If this is the way forward and we're seeing it impacting people's lives, we get lots and lots and lots of horror stories of people being left to fend for themselves, left in soiled sheets, not able to go out for weeks on end. people that aren't fed or get provided with hydration for days and again end up in hospital. This isn't the right way to do it. And to be honest, I think we have to get to a point where parties are willing to talk to each other, where bold, credible options are put forward, where different members of this room, different members of the panel, the public are shouting about this. We've done some polling with YouGov. We know that social care is rising up the tables in terms of priorities for people. We know that actually quite a large number of people would willingly put something towards their care costs, but that actually it shouldn't be something that completely decimates A, their finances, B, their hope for the future, or C, put them off from accessing care in the first place. It is the right time to do it as we get to this point where people are listening. We can make a lot of noise about it, and I'm delighted to see and talk to everybody here today.
Well, I think the panel set us up very nicely. I think it is worth remembering it's not just about very old people. We often think of social care and residential settings and so on, and someone needing care in their home as someone who's in their late 80s on their own, but there are a lot of couples where one party has got early onset dementia, the nasty versions of early disability, and so it's not just about the very old. It's a more complicated spectrum. But I'm sure there are going to be plenty of questions and interventions. I'll take them in threes. If you can G them up to be short and direct. I'll take the lady straight in front of me there, please.
Thank you. My name's Alison Barnes. I'm the PPC for Rosendale and Darwin, and I also have the great pleasure of being the leader of Rosendale Borough Council, which is a very small district council in East Lancashire. We're part of a two-tier system, and I'm really, really concerned that Lancashire County Council will, in about 18 months' time, fall over. Clearly, that will leave our residents in need of support on lots and lots and lots of levels. It's a political question, I suppose. Where are we going with all of this? The underfunding of local council services has got to a level now that, as I say, is seeing councils fall over, or will do. And I just wondered what your thoughts were on that.
No, got that one. The gentleman next to you.
Hi, Andy McCulloch. I'm a support worker in Liverpool. I did used to work for Liverpool Council until the job that I'd done was privatised. Now I work for an agency for £3 an hour less. But nothing you can do about it. It happened, and that's it. You've moved over. As you're talking about tax, and you're talking about tax. You're saying it's an insurance. It's a tax. It's the people who earn the least money that will be paying most of that tax. That's not fair. The whole tax system needs changing. So as the likes of Amazon, Starbucks, Google, they pay their fair share, and that's more than enough. So as somebody like me who's just above minimum wage doesn't have to pay any more and is not out of pocket. So as rich people can sit there looking down on me and telling me I've got to pay for things.
Lady at the front.
Amanda Fisher, local district councillor at Mansfield District Council for the Woodhouse Ward.
Could you repeat it, Warwick, when you...
Why don't you use this?
Yeah, we can have a go. Have a go at that one.
Is it better if I stand up?
Yeah.
Amanda Fisher, local ward councillor at Mansfield District Council. I'm also had to leave my job to help look after my mother who's got dementia, with a dramatic cut in my pay, because I had to take a pay cut because I was a support worker before that. And I'm talking about £600 a month I lost when I started doing that. But when I was working as a support worker, I saw cut on cut on cut on hours of support that was delivered to the tenants that I supported, which left them in dire need when they needed to go shopping, when they needed prompting for personal care. You know, I saw a deterioration in those tenants completely different to what they were 6 months ago. And another thing that I wanted to raise, that my dad was in the army. He's always worked, my mum's always worked, and my dad is now having to pay towards my wages to look after my mother. That's got to be wrong on every level, and it was time that we got the big corporations to pay the taxes, use that money, fund it, and make sure that the people that need social care get it. And just on one slight note about younger people, my parents have also brought up two of my niece and my nephew through guardianship orders. My dad had to take the local authority to court to get money that they should have given him in the first place. He had to fight for that. He used all his savings to buy furniture for the veterans and clothes on their back before he got any money back. That has also got to be wrong on every level. Thank you.
Thank you very much indeed. Now it's not my turn. So I think if we kick off, if Tony, and particularly if you, obviously this issue about the financial viability of local authorities over and above their specific responsibilities for social care is clearly a big issue.
Well, as I was trying to, we all know this story now. It's because of the way that, just understand the point about whether it should have happened or not, but the way the deficit was reduced by freezing public spending but protecting some of it, left local government most exposed, apart from the prison service perhaps, and in the end, you can't hide the fact you cannot deliver not just £100 of services for £70, but in the end, £120 worth of services because the demand's growing for £70. That's the underlying problem. And I'm afraid, that as a society, we either have to decide, this is a Labour Party conference, that we are going to make tax more popular and, tax avoidance and tax... Hang on. Yeah, no. Hang on. Yeah, but hang on. But tax evasion and tax avoidance will only go a small way. They will, and it's very... We had this, oddly enough, we were in this room having an equivalent discussion this morning. Getting tax companies that don't pay, that avoid and evade to pay, is one thing. Very hard for individual countries to do. And it's, it needs international agreement. So I'm not disagreeing with you. But the other thing is, it won't bring in enough money to allow the kind of uplift in public services that by implication people want. And that's why I say there has to be an argument, if people want to have a bigger state, to ensure that taxes are more popular than politicians have interpreted at general elections for a long time. That's all I'd say. Because it's possible for governments to put taxes up more broadly, but to do it, they need popular support. And that has not been, as far as I can see, visible. And not politicians of all parties haven't interpreted it like that. So that would have to happen. Having said that, you can't go on cutting local government in the way it's been cut, okay? It's just not mathematically, unless the government eventually says local government's not going to do all these things anymore. No politician in any party will say that, so in the end, something will have to give. And Northamptonshire, which in some ways was the victim of its own failure to make decisions, was an indicator of the way other counties will and are beginning to go. And of course, one final thought, the government has got itself into a position of responding when services fail. It did it with adult social care, it did it with prisons, it sort of did it with, potholes and roads and all of that. And it's not a great way of planning public spending. It's got to be done over time. We've all been too kind to successive governments who've tried to do something about funding of care, particularly for older people, and always walk away from it. They will not bring themselves to tackle it. And it's another of these issues which tell us how weak national politicians have been in being brave enough to confront the public with the fact you cannot have, as it were, France's public services for America's taxes.
Back.
Well, of course, in terms of, first of all, council funding, obviously the government are going through a process of doing a fair funding review. And call me a cynic, but I can't see that that's going to lead to more money coming into the cities like Liverpool and maybe even Rossendale. And I saw a quote from one of the ministers a couple of weeks ago that said that he will ensure that there is fairer funding to the more rural parts of our country, and I probably assume that would be more the home counties, probably than the rural Rossendale. But it's so I'm not holding a candle for that one. But I think there has to be a review of council funding. I mean, the Barnett formula doesn't work, which is why we had area-based grants to provide some rebalancing around, so that councils got the additional money to deal with the additional needs within that were greater in some cities, like there are in Liverpool, for example, than they are in other places. In certain parts of Oxfordshire, but so I think that's got to be a fundamental review, which is bigger than than wider than this discussion. But that's fundamental to the kind of funding that we need to find for adult social care. In terms of your agency work, I was going to say that before, and actually, if you want to tell me after who you're working for, I'd be interested to follow that up. But yet, there's been an influx of social care. In some respects, has become a property business and a profit business for agencies and recruitment agencies, and you're getting a lower wage, but that's probably because the money that's going through, that's finding its way through to you, has been sliced to such an extent that your £3 an hour has gone somewhere else. So I think we have to also look at the way that we deliver some of those services locally, and I think that we have to up our game. As a council, we've signed the Unison Ethical Care Charter, and we're not there. We have to work towards it. We've got. We need to look at. Personally, I think we need to look at bringing some of this provision back in house again, and in terms of working with our, some of our voluntary sector partners like Local Solutions. Chief Executive's here today. It's a great partner in the city that we have to work with those organisations together in partnership properly, without going through all the procurement stuff. In partnership, because we know what we need and who we can work with to deliver it, to do it in a better way. So I think that's I can't remember the point that you made was about.
A number of points really, but my main was about the fact that I had to give up my day job because the hours.
Oh yeah.
Essentially, it's about the challenge of being a carer without proper support.
Yeah. And also the fact that my dad's now paying towards my wages to do that.
Yeah, and of course that.
He's not got any money, he's not loaded, he's not.
No, that's of course what happens, isn't it? When you cut public services, you end up pushing the burden back onto families. I've had to do it myself, and that's obviously what happens. And to a certain extent, obviously, that's what we do as children and carers for people in our family. We do that, but we shouldn't expect too much of us. We need that extra support to be able to do that. And again, it just comes back to the other issue around the council funding. I think government needs to think about, if we're being serious about adult social care, we need to ring fence it so it's identified as a service that we're providing on a local basis as part of a national welfare state.
I certainly think, before I bring in Dominic, that there is a real challenge in the procurement of these services. I can think of one London borough where social services were contracted out. It was my cousin who was the contracts manager. He got contracted over. Yeah. And in social care, which has been underfunded and squeezed for getting on for half a generation, he was then presiding over taking out some further 30% out of the contracted out budget. Now, that's not going to be a runner. Dominic.
So Alzheimer's Society have been closely involved with the development of the Green Paper on care reform, which is long awaited, and we assume will be coming out in the next couple of months to suggest what government are thinking about the future of care. Within that, and from the message from inside, I guess, seems to be that they only will really wake up once disaster happens. And I think we're seeing that in pockets, and we're seeing that in individual cases, the people that come to us. But as perhaps we've seen with kind of a previous failure of a large care home provider, that actually it will probably be only when significant councils do collapse, essentially, and that services are almost impossible to deliver, that we will see any kind of significant reaction and significant change. It's interesting to see that there are 3 Conservative councils that have recently kind of launched a plea for help, for example, and we think that obviously quite a few more will follow them in that respect to say, actually, what do you want us to do? We are caught between a rock and a hard place. We have an increasing level of need in our community. We've cut everything that we can. Community bases have gone. Home care hours are down to a minimum. Care homes, in our experience, they've had their kind of additional sums of money for providing complex care like dementia care taken away from them. Where else do they go? And then I think where they have been going, and this reflects onto the other point, is that they have been going to the voluntary section, they have been going to family carers. There are about 700,000 family carers across the UK for people with dementia. they offer about 1.6 billion hours of care a year. And these are sort of mind-boggling numbers that don't necessarily compute, to be honest, but those hours are only increasing. And colleagues from the LSE have done some modelling that suggests that actually we're not too far away from a point where there will not be enough informal care to go around for people with dementia. And again, what happens there? And actually we're seeing people leaving the workforce in droves, and there are a significant proportion of family carers, people with dementia, who have left the workforce. Not only people caring, but actually, you know, point well made by Warwick, that we're also talking about younger people, or people of not of retirement age here. And there are about 40,000 people in the UK under the age of 65 living with dementia, and many of them feel that they cannot continue with work, that actually the employers are not giving them the opportunity or the kind of flexibility to carry on with their career. And so we're seeing thousands and thousands of people either with dementia or caring for people with dementia or other complex conditions leaving the workforce, expense to these big corporations in terms of finding recruitment, expense in terms of upskilling again, expense in terms of the benefits that should be paid out and the enormous amounts of red tape that inevitably comes with that. And again, this kind of suggests that all this money is being sort of drawn away, and yet it's just being, you know, being shoved somewhere else, and it doesn't make sense. And actually, if we start to be able to put some of these arguments together, we've been looking at kind of, well, if you were able, without all the red tape and all the turmoil that comes with it, to access all the different benefits that you should be able to access, and one such example is being able to have reductions in your council tax if you have dementia, which is quite often kept fairly under wraps for different reasons. That actually, you know, there are different things that you can do, and how do we get that money back to people? How do we make sure that they are supported to continue living well?
Now, I think we have another round of questions. The gentleman there, you may have to use this perhaps.
First of all, every single one of you in this room, regardless, will become disabled at some point in your life. So get used to it. You're going to have to get to this issue straight away. Secondly, I've got Parkinson's disease, diagnosed at 55. My wife was part of the social care system for 27 years, because my wife's been blind for 27 years. I'm now her carer, and she is now my carer. And there is no way in the social care system that works that one out. They can't give it to both people, basically. You either get as a carer or you get as a caree. The other thing is concurrently what was Dominic saying, basically. Volume of unpaid care in the UK in 2017 was approximately £132 billion. £132 billion. Healthcare spending in the UK in 2017 was only £134 billion. That gives you the dimensions exactly what you're saying. The other thing is I'm now a bed blocker. You can wear the badge. I'm going for hernia operation in December. They won't let me out because my wife, she doesn't have a home help. So therefore I'm now also become a bed blocker. To summarise, basically, I used to pay £40,000 a year in tax as a consultant. I'm now paying nothing in tax, and I take money out of the state. Again, confirming what Dominic said, basically, when you become disabled, you start drawing money out of the state, and it costs more to actually look after the disabled person than it does actually to keep them in employment.
Thank you very much. Lady there.
We know from research I've done and many other people have done that women are the key caregivers in our society, social care and generally social infrastructure. We also know that women have been hardest hit by cuts to these from austerity, not only from the care that they give, but the care that they receive paid and unpaid, and paid at a very low wage, which has already been mentioned. And I guess I'm slightly disappointed that this all-male panel
So are we disappointed, and unfortunately it's because Sally Cropley from the Alzheimer's Society couldn't come and join us this afternoon, and so we've had to magic up Dominic to actually help us.
still mention it.
Yes, yeah. Now the gentleman there with the spectacles, and the lady there, and the lady there. I try to do it roughly how I see people first.
Just maybe a question for Professor Travers.
Yeah.
Where's the nirvana for this kind of thing? I mean, which country stands out in terms of social care? I suspect when we look at the difference in equality in that country or those countries, therein lies our answer. But perhaps you could enlighten us.
Hi. A friend of mine, she's been put down for a liver transplant. So who's going to be responsible for her adult social care? Is it going to be the NHS, or does she have to rely on her council?
My understanding of that, because I find myself going through this on a number of occasions, both in private life and also having once been involved in the social service committee, it should probably be the National Health Service under continuing care, because it's a directly clinically related matter. Related there.
So you all agree that everybody seems to be in agreement that the long-term situation requires things to be paid for through tax. So could you put together a sort of convincing way of ring-fencing tax? Because then the public would have to be quite sure that it was a fail-safe ring-fencing, because otherwise they'll be quite cynical and say it'll just be siphoned off into other things. But if you could come up with something like that, then I think the public would be in favour of it and it would work, you know.
Right. Lovely. Shall we start from this end? Dominic.
Yep, of course. In terms of the Nirvana, I guess that's one thing that's incredibly difficult, is that the Nirvana doesn't seem to exist. So many countries are going through similar issues in terms of ageing societies, in terms of some of the same problems in respect of where do you get the money from, whether, I think things have changed so quickly in so many different places. We do see nations that are at least a little bit bolder in some of their approaches. Some of the names might not be that surprising. Let's say sort of different parts of Scandinavia, Netherlands, Germany, they've all kind of approach care. Sweden is very good at trying to put as much support into the community and making sure that people can stay with their families and stay at home for as long as possible. There is a lot of work going on at the moment to try and compare different nations' approaches and try and take on some of that learning, I guess, and credit to different parts of the country in terms of councils that actually many do kind of think, well, what can we put in place that might be beneficial? In respect into this being sort of a massive feminist issue, absolutely, and dementia in particular, it's something which there are a lot more women than men living with dementia. In terms of the kind of the caring responsibility, I think that's very interesting for whether the state or the individual should pay for it, because actually I think too often it's considered that caring is a family duty and that it's something that people should just be doing, and therefore why should it be something which is involving professional? Why should it be properly paid? And actually, seen as a fairly unskilled role, and yet from what we see, what we witness every day in terms of dementia support, it's an incredibly difficult and incredibly skilled role, particularly if you are going to somebody's home by yourself as a carer and you are facing somebody who is very agitated, who is very anxious. To be able to tackle that is really quite challenging, and yet we don't recognise that, we don't have that in the public consciousness. And it's definitely a really important part of the conversation to be able to get that out there and to try and right some of those wrongs.
I take the Nirvana, obviously. Well, first of all, I was waiting. I knew I was going to get into trouble for being on a panel with that woman on. I was looking where Sally was, and I thought, what's Dominic doing? And I kind of worked it out. But quite right, absolutely right. Yeah. No, there needs to be a woman on here, I agree with you. You should come and join us. No, you're right, absolutely right.
Somebody was, to make you feel a bit better, somebody told me that at one session yesterday in conference, they started to talk about women's issues, and loads of men got up and left.
Did they?
All the men.
Oh, okay.
That's how it is.
Okay, so to answer the question, I think we keep talking about a similar kind of thing, really, and the whole issue around public taxation, public spending has got to start from the position about what kind of country do we want. Do we want to have a country that properly looks after people who are in need, whether they're a bit younger or older, more often, who need that either residential care or that domiciliary care? They're the questions that we need to start with once you ask the right questions, then you start looking at what the right solutions to these things are. And of course they're not easy solutions, and of course it costs a lot of money, but pensions cost a lot of money. And we have to find a way of funding state pensions, which is another separate issue. We're going to have a whole separate discussion on that one, and this is no different to that. So it's an issue around public spending, on taxation, on greater equality. Personally, in terms of making taxation more popular, I would like to see, we have a trade-off between reducing VAT and a more progressive taxation system, then we'll all start thinking about our taxation system, wouldn't we, and what it's there for. Because since the 1970s, we've moved from a situation where we did have a more progressive taxation system, where the more you earned, the more you paid, to one where she shifted over towards VAT, where regardless of what you earn, you all pay the same. 20%, it's unbelievable. That was supposed to be a temporary measure, but it's not. So we have to look at, I think we need to look at that, and that may be a way of stimulating that debate around, around taxation. And I think we also need to look at, we know where the issues are and exploring some of the solutions to some of these things. And maybe, and as the council were thinking about, well, could we pay? Is it worth paying for someone, if they can, to either have an extension to their house or to be able to offer them another house to move into, because we're starting to build our own houses in Liverpool again, that will, if they can, if they're in that position where their elderly relative can move in or have their own flat next to them, for example, is that something that we should look into as a local authority? I think we should. I think we can. I think we can do that. I think we've lost some of that. Some of that sort of community-based. That community, the sense of community and the support that community will have. And I'm not saying that we shift this down to people's own goodwill, because that's not what that's about. But there's some element of it where people aren't as got such acute problems where they need to be supported to live at home. That there's something that we could do there. And we had a lot of the I can't remember what it's called now, but the sort of healthy living schemes to encourage people, to support people to be able to live longer at home. Because some of it's not just about somebody coming in, it's also about some of the modifications that can be done to people's houses to make them make convenient so people can actually stay there a little bit longer. So there's all those kind of things that I think we need to look at as well. But obviously behind this, the fundamental one, we keep coming back to it, is where the money's, where the funding's got to come from. And I still believe it's got to come from the state.
Well, we bumped into the triple lock on pensions eventually, and of course this is a lot of what we're discussing is a matter of public spending priorities as well as the right level of tax. If I tell you that the increase in the amount paid out in state pension between 2010 and where we are now is double the total spent on adult social care in England. So the amount that's gone up is bigger than the annual spend in all adult social care. You can see that politicians have read what they do. It's a priority issue, and that tells us, I'm afraid, that despite the excellent work done by organisers like those represented here today, the more vulnerable people are in society, the weaker their voices have been in the past, the less likely they are to be as a public spending priority. So even within a group, older people, state pension and a great chunk of adult social care, even their politicians divine priority and react accordingly. Bad news. On the question of ring-fencing tax, I understand why people think ring-fencing tax might protect things. My only slight concern in your own interest is this: taxes can go down. And if you ring-fence, so if you...
In terms of revenue yield?
Yeah, the revenue in a year. In a recession, we're going to have a recession again at some point. We always do. And the trouble is, the money then falls and you have to top it up. So I'm not sure ring-fencing can ever work. I think it comes back to the amount people are willing to pay in tax, and politicians are willing to ask them to pay and then provide it. So going back to the Nirvana question, in France and Sweden, the state is 56% of the economy. In Britain, it's now 38%. Germany, Netherlands, it's around 44, 45, 46%. There is a choice to be struck. But you have to balance the books just about whenever you strike it. And that's why it pushes you back again. It can have a bigger state, but it would require higher taxes. If we're going to have a state more like America's, which is 36, 37% of the economy, we can have lower taxes, but we won't be able to have a full welfare system, full railway system, and everything else that politicians of all parties offer us. So that has to be addressed. That challenge has to be addressed. What kind of society? More like Scandinavia, more like America? I can guess what this audience will think. But there are other political parties and other politicians.
One of the things that's fascinating about this whole social care agenda is that, oddly enough, in the United States, through the interaction of Medicare and Medicaid, the means testing regime that households face is a much lighter and less aggressive one than actually operates here. It's one of the oddities of the complex American healthcare system. It's the one bit where they're more generous. Now, there are two questions about... there's the gentleman with his hand directly in front of me who's wearing a grey T-shirt. There's a gentleman next to him. So we start with the grey T-shirt and then the hand with the next to him. So, yeah.
Thank you, Chris Kavanagh from West Derby CLP. Mine's basically a two-pronged question. Within daycare, children's nurseries, we have ratios of staff to child. In care industry for people with dementia and other issues, that doesn't really seem to be the case. And I say that through experience because my father's in a nursing home and he has been for 3 years with dementia. What I find is the pressures on the workers and the professionals that are supporting the people that are residents within them care homes. Agency staff are coming in to fill in for them and the quality of care then decreases. So what will the Labour government, when it's in power, do about that? My second question is with regard to local authorities, and when they commission these nursing homes, what penalties are enforced on them when the care given isn't adequate enough? And I know the CQC have got a responsibility in there, but they're only the guardians, they can't police it all the time. So when I go to complain about the lack of staff caring for my father and other residents, I think what it basically comes down to is institutionalised neglect from big corporations who are taking the money but not giving the quality of care.
Right, and if you could just pass the mic, yeah, very neat.
My name's Liam O'Toole. I run Versus Arthritis, which is the charity that supports people with pain, fatigue and isolation of musculoskeletal conditions. But I'm also a member of the Richmond group of long-term condition charities. And the point I wanted to make is that our conversation with policymakers at the moment, there's lots of enthusiasm around social prescribing, around the role of the voluntary sector, and we're told that it's the decade of the volunteer. Well, the charity sector in this country does a fantastic job, but volunteers don't just appear. They need to be found, they need to be trained, they need to be supported, they need to be thanked. So the message we're trying to get into this rather strange conversation about the new 10-year plan is you have to have some sort of financial model to work in partnership with the voluntary sector for social prescribing, because it's not going to just happen.
George. And the lady there with the blue dress and blue hand. Yeah.
Hi, thank you so much. I work for a charity called the Travers Trust, which runs the largest network of food banks in the UK. It's been really interesting to hear from all of the panel, but particularly the representative from Alzheimer's UK. I think definitely for people working in the voluntary sector, this isn't a question about who's paying, it's a question about exactly how many volunteers are doing the job that really the state should be doing. Some could say. So I think that's definitely something to think about. Volunteers can only offer a certain degree of dignity and a certain degree of kind of standardisation. So yeah, it's very much a question of what kind of care and the quality of care you want as well. One final thing, sorry, that I'd say is that half of the people in food banks are disabled, so the kind of, and people with caring duties have a lot, obviously, higher cost of living, and that has a knock-on effect on your kind of finances. So this is very much an issue that goes far beyond just older people or very young people in care. It goes to families and people far beyond.
Lovely. Now, I'll take one more question, and what I thought we'll do is, as we're getting towards the end of our allotted time, I'll then ask the panel to give a considered gloss on the questions and their sort of final parting thoughts to you collectively.
Yeah, first of all, I'd like to add to this gentleman's question before that my brother himself suffered. There are a lot of specialist areas in social care that requires a lot of fund and specialistly trained people as well, specialist care homes, like people suffering from Parkinson's. My brother himself suffers. He's been moved from one care home to another care home, from one hospital to another hospital. There's no speciality. It's a very, very complex thing. So we've got to take into account it's very, very expensive. But I've got another on the finance side. My work takes me to Germany and Holland as well. The social security payment, which is like NI here, far, far more than here, what we pay. And also employees, they pay much more. But there's a cap for the employees here. So that need to look into it. That's a very simple way of tackling this. That's how they have tackled it.
Thank you very much indeed. If we work across this way, if you could give a gloss on the questions and also your sort of final framing of what you think the issue is.
Okay, well, I'll talk about volunteers a little bit on the basis that kind of two aspects covered that, and Alzheimer's Society find similar things in terms of actually trying to find people that can do that, and actually when we're putting so much burden on people to care anyway, how it's difficult to be a carer and a volunteer and have work and everything else that comes with it. It's actually the pressures that are being put on people make that an even bigger challenge. It kind of combines with the point around CQC and around quality standards and around ensuring that the people that are providing care kind of know what they're doing. We did some work with Unison around home care workers, and we talked to those home care workers about the kind of training that they received for dementia support, complex condition. And about a third of them came back and told us they had no dementia training whatsoever, which, as I said before, is clearly, to ask somebody to go in and support somebody with a complex condition and no help, no training is appalling. But we are seeing a sector where there's about a 30% turnover in staff each year. Within the home care sector, it's at least that. Care homes have a similar problem. You have new faces coming through the door all the time, partly because it's a poorly paid job, partly because it's poorly recognised, partly because the pressures are incredible. And so as part of that, you were seeing lots of different people come in. You were seeing training not being provided, support not being provided, wages not being provided. And so it's maybe a little surprised that actually the direct correlation with poor quality is seen across the country. Again, a lot of that slack then falls on volunteers and falls on family carers. And it's another sort of poor use of cash, poor use of resource, and a focus that the care sector doesn't need to be trying to consistently find people, when actually, we could do a lot better by training up people, helping them to feel valued, and actually giving them the recognition they deserve for the incredible job that they do. I think on a couple of the other, I guess a bit of a summary. I think the points that we've had from the audience really highlights that I think we're saying that there is too much individual responsibility right now, whether that is directly from paying, or whether that is from taking on huge amounts of responsibility on the caring side. It does need big conversations about what does state responsibility look like, how do we do it. We've already covered quite a few different ranging examples here, ones that are taken on abroad, ones that involve taxation across the population, and some which actually focus maybe on those that could be putting in a bit more. It means that we have to keep talking, I think. I think it's frustrating. It's the years that I've worked on it, it seems like there's a lot of circular motion. But at the same time, if you consider where we are now compared to where we were a few years ago, it does feel like there is some kind of momentum behind it, and we are starting to talk about care alongside the health service, alongside the economy, alongside people's sort of health and well-being. And I think that's incredibly important and something which Alzheimer's Society will continue to campaign on. We love talking about it. We're in the main exhibition room at number 67. Come and chat to us about our campaign and all our stuff. I think keep going. Everybody in this audience is more interesting hearing from you than it is hearing from me, frankly. So we need to keep talking about it and keep that movement going. Thank you.
Thank you very much. Thanks.
I don't want to criticise our agency workers. We've got a comrade at the back who's an agency worker in the home. So it's the quality of the work. I think the issue is around, which I said before, around the increasing use of agency work in care homes as well as everything else. The problem is what I said before. Really, while we don't run care homes, we're always at the risk of them closing, and then we just have to find somewhere else for those people to go. And one that closed down a few weeks ago in our city wasn't a big multinational organisation. It was actually one that was owned by a housing association. So we have to be clear where accountability lies for services like that, even if they're at arm's length for us, because those organisations, even if they're delivering on our behalf, have to have responsibility to maintain and deliver the services that we expect for our people, whoever they are, and they have to be accountable to us. When I say us, the council, in terms of their democratic accountability, because that's the only way that we can ensure that needs are met through services, and that also has to mean, I think, that we have to look at bringing more of our services, particularly in care. We have to bring those services back in-house, albeit with a partnership with other organisations. And when I say voluntary organisations, I mean not-for-profit. I don't mean organisations that will sort of get a whole brigade of people who are volunteers, who are willing to give up kindly give up their time. You know, people, not-for-profit organisations, because they're the ones that are also working in this area at the moment, particularly in Liverpool. And I think we could work much better together if we came together, I think, under one organisation to provide that kind of delivery. The one thing we haven't mentioned here is prevention. There's a difference between, if you look at the poor areas of the city to the more affluent areas of the city, there's a difference in 20 years in terms of living with good health. So that is telling us that, and if we're saying that, I think it's 6% of people with a disability are getting into work. We're not creating the opportunities or providing that kind of way of life for people so that we don't want people to require these services at the end of the day. We want people to live as long as they're possible with the best health they can. And that requires a whole series of other changes that we need to make in terms of giving people those opportunities when they're younger in life, so that they're not faced with those choices later on in life. And of course, we all know that infirmity and ill health can hit us, and disability can hit us at any time. But when it does hit us, it needs to be there when it's needed. But the more that we can do earlier and in people's lives, the more that we can provide that support as well, surely for people who need it when they're coming through later on. So I think that also means that we need to look at that delivery on the ground, which I was talking about, and that's part of those kind of services that we need to make for at all sort of graded level of services for people that they need all the way through through their life. And at the end of the day, I have to say, and just repeat what I said at the beginning really, this cannot be funded through private insurance. This cannot be funded through private insurance. This has to be funded. It's a responsibility of the government. It's a responsibility of the state, from central through to local government, with adequate supply of funding. And that's what we need. And dare I say it, we're only going to get it with a Corbyn-led Labour government.
There's no question that adult care has, like as I said earlier on, done less well out of the allocation of public spending because, for reasons that I don't need to spell, it's a weak lobby compared with many others at any point in public spending. That is true. If you look at the way in which particularly care for older people in homes has been provided, the costs of the contracts have been driven down to the point that at the end of last year, the Competition and Markets Authority, a government agency, by the way, reported that councils have been so successful, because their own finances have been cut, so successful at driving down the cost that most of the sector is near bankruptcy. That's the kind of strange world we've ended up in. Another issue we haven't talked about today is migration as another way of helping to pay for, particularly in the southern part of the country, adult social care. And for those of you who want to see something that you think, wow, in fact, I've got it here. The Migration Advisory Committee, you may have seen this in the press last week, published its report about the kind of migration system we ought to have, in their view, after Brexit. And there was a section on social care. I won't read it all, but it says this: with an ageing and expanding population, social care needs will grow in the UK. The sector's problems are not primarily migration related. A sustainable funding model paying competitive wages to UK residents would alleviate many of the recruitment and retention issues. Unless working in social care becomes more desirable to UK workers, chiefly through higher wages, this is a government agency, a government independent body, chiefly through higher wages, migrant workers will be necessary to continue delivering these services. So the Migration Advisory Committee has come to the conclusion that if we don't have less migration, which they in effect recommend, then the government's going to have to pay more. So, the skies are indeed dark with chickens coming home to roost, as Dennis Healy memorably once said. So I think bringing us back to the subject of this afternoon, the truth is that until and unless a government is willing
to address the kind of issues that we've been talking about this afternoon, the whole sector will remain under stress. And that will either have to be done, as I say, by putting taxes up or by bravely saying the state will do less, and politicians won't do the latter.
It's very difficult to cut what the state's currently doing because it's so reduced, particularly compared with other international comparisons. And before we go home too miserable, I just want to say this to you. I'm quite confident, having thought about this for many years and done a lot of work on it, this is a tractable set of propositions. This is not something that is impossible for people to actually handle. And in terms of the long-term UK funding costs, whether it's the old age pension, other pensions, social care, and that part of the acute healthcare budget that goes to it, of course, we are significantly lower than the OECD average. And there's quite a lot of scope for us to actually, within a tight, awkward public expenditure outlook, still make discretionary priority changes which will help in this area. So thank you very much for coming, and thank you very much for being a panel and helping us.